Welcome to Informatics in Healthcare. This PowerPoint refers to the introduction of a new interdisciplinary plan of care at my hospital facility. The objectives covered in this PowerPoint presentation are the following. Explain why an interdisciplinary plan of care, or IPOC, is relevant to our current and future practice. Describe how research relates to the introduction of the IPOC. Understand the legal and ethical concerns presented by a new IPOC platform. Outline the plan for introducing the new IPOC platform, including training. Describe tools that may be used to evaluate the success of this new platform. Explore the financial ramifications of this change, and identify the changes in public policy and technology that could affect this change and the implications for the healthcare industry as a whole. Why introduce a new plan of care platform? Currently, we are using a plan of care that was transcribed and adapted from paper for our Epic-based electronic health record, or EHR, which was acquired by our system in 2004. This old care plan system is nursing-focused and not friendly to other members of our interdisciplinary patient care team. Over the intervening years, care plans have had to be added and adjusted to suit changing treatment options and plans. The current system is not able to provide statistics for interventions or patient care. The system is also not able to identify when interventions are inadvertently repeated in different care plans. It is also not linked in any way to patient education, and there is no way to have interaction with documented patient care anywhere in the EHR. Also, the new interdisciplinary plan of care platform has been created by the vendor Elsevier. This product has been utilized at other similarly sized healthcare systems to interact seamlessly with their Epic EHR. The Elsevier IPOC is capable of interacting with and drawing information from Epic documentation. It can also be linked to pre-populated patient education charting system, which is in turn linked to educational materials that may be printed for or viewed by patients and their families. Interventions for each care plan can be customized for the patient, and repetitive interventions can be avoided. Why should we introduce a new plan of care platform? The new platform will cross-communicate between medications, flow sheets, and care plans. As can be seen on this PowerPoint, medications and other interventions can be noted. Research and the changing face of care planning. Increasingly sophisticated IT platforms in healthcare make customization of patient care more feasible. Cost savings can be obtained through various customization approaches to healthcare. These include, but are not limited to, customized surgical interventions, individualized diet plans, customized rehabilitation and discharge plans, nursing care specific to patient and condition. Conversations with patients by nursing staff and other disciplines such as dietary, rehabilitation, social work, and discharge planning can take into account patient treatment, diet preferences, and values. These conversations are reflected in the IPOC. The information generated by this individualization can potentially be utilized in research in the form of big data. Legal and ethical implications of this change. The ethical and legal challenges in the healthcare industry often arise from inconsistency in planning and practice. The care plan platform we currently use is isolated to 2 out of 5 facilities in our system. The other three hospitals, along with various outpatient clinics and home care agencies, will be included in the system-wide introduction of the new IPOC platform. This uniformity will ensure patient care occurs across our healthcare system consistently. The use of one IPOC system will enable all disciplines to see the care plans initiated by each member of the team. This visibility and customization will ensure added consistency to patient care. Elsevier care plans are founded on evidence-based practice, providing solid ground from an ethical and legal perspective. The available assessments and risk screens are also based on best practices. The provider also allows for 500 clinical practice guidelines and care plans, allowing for individualization of care and standardization of practice. Transition to the new IPOC platform. The first point would be to identify the task. What is the required final outcome? It is the successful transition and integration of a new IPOC platform. Who are the stakeholders? These would include, but are not limited to, IT personnel, nursing, rehabilitation, dietary, social work, and case managers. What will training look like? Train the trainers will be undertaken by the vendors. Instruction-led training will be conducted by these trained individuals for all users of the new system, including in a classroom setting. E-learning will be available to provide ongoing education for staff and updates for the system. Evaluation of the new platform. Any evaluation should include insight into the time required for learning and adaptation. This is represented by the learning curve, enhanced by the use of super users and playground activation for both practice pre-introduction and post-go-live date. Is this system user-friendly? How difficult is it for the user to learn and use? User acceptability. How useful is the system to the stakeholders? Is it relevant to their work? Financial implications are also important. The proposed platform produced by the vendor Elsevier is available as an a la carte system. Customers are able to build the system they feel is needed for their patient population and stakeholders, depending upon the allocated budget. The cost of this product is dependent upon the final options decided, along with the desired update regimen. Add-on components include suggested education points for each care plan, as well as printable or web-based access education materials. Updates can be provided annually or 2 to 4 times per year. Also, these updates are provided at the same time as the update for our Epic system, so these updates would integrate seamlessly. The big picture. Existing changes in public policy have already affected the actions of our healthcare system. Changing statistics and benchmark requirements from Medicare, the Joint Commission, and other regulatory agencies and associations have increased and altered patient care requirements along with the information gathered from healthcare providers. These requirements include but are not limited to hospital-acquired infection and injury rates, breakdown of patient by gender, age, admitting diagnosis, and other demographic factors, reintubation rates, and readmission rates. These measurements are not static and may change over the coming years. Information is gathered from various areas of a patient's EHR. Upgrading our IPOC will enable more effective collection of data to assist with these requirements and benchmarking. Thank you for your attention. I hope I have successfully explained why a change in our nursing care plans is important to our healthcare system. Please find our references below.